Hello guys, once again, welcome to Medycoding.com. So today we are going to learn about the synovial joint, and this is very important topic for the medical coder. This topic is helpful for CPC or CCS candidate and most important for surgery coder. Other than synovial joint, there are other two types of joint based on tissue or structure. Those are fibrous joint and cartilaginous joint. You can see in this image the joint in the skull are fibrous joint. So in case of skull, this fibrous joint is termed as sutures. So fibrous joint are the joints that are connected by dense connective tissue. They allow no movement. It is also known as immovable joint. The next joint is cartilaginous joint. So in cartilaginous joint, the bones are connected entirely by cartilage. They allow limited movement, or you can say minimal movement. In this image, you can see this is pubic symphysis joint. So this is cartilaginous joint because right and left side of pubic bone are connected by this cartilage. Other example of cartilaginous joint is intervertebral joint. So you can see in this image, these are two vertebral body that is joined by intervertebral disc. So these are the example of cartilaginous joint. Let's move to our important topic, that is synovial joint. So synovial joint is the freely movable joint because of its structure, and it is found in all major joints of the human body like hip, knee and shoulder. The term synovial joint is given because of synovial fluid and synovial membrane involvement. So these is synovial joint. So such joints, the bones are not in direct contact. There is space in between two joints, and that space is filled with synovial fluid. Since fluid is there, so these structures are enclosed in some coverage that is called as a capsule. So let's discuss the structure in detail. So this is the complete structure of synovial joint. This is the two bone that is involved in joint. You can see in this image, these two bones are not in the direct contact. The space is filled with synovial fluid, and synovial fluid reduce friction. The end of the bone has some covering that is known as articular cartilage. So here it is called as hyaline cartilage. This cartilage gets nourishment by the synovial fluid found in space. You can see this layer. This is known as synovial membrane. This secretes synovial fluid and also it lines the capsule inner structure. So all the structure of the synovial joint is enclosed in casing that is known as capsule. So if surgeon has to enter the joint, they have to cut the capsule. The capsule of synovial joint has two layers. First one is outer fibrous layer. It is made up of tough fibrous tissue. This layer is also called as capsular ligament because it connects bone to hold the joint. Other layer of capsule is inner synovial layer. That is synovial membrane we already discussed. So this is all about the synovial joint. Shoulder, knee and hip are the example of synovial joint. If someone says synovial joint, so you have to assume all above structure. In next lecture, we will discuss anatomy of major joint. Please stay connected and support us by subscribing and sharing to your friends.